What if I told you that one of the biggest reasons people over 70 fall is not because they are weak, not because they are careless, and not because falling is just a normal part of aging, but because their body has quietly lost access to one small reflex it was designed to use automatically. A reflex so simple, so built in, and so important that when it fades, one ordinary misstep in the kitchen, one uneven patch of sidewalk, or one awkward turn in the hallway can suddenly become a trip to the emergency room. And I do not say that to scare you. I say it because most people never hear this until after a fall has already happened. They think balance just disappears with age. They think feeling unsteady is something they simply have to accept. They think the answer is to move less, do less, and be more careful every second of the day. But that is not the full story, because in many cases your body still has the ability to become steadier, faster, and more responsive. It just needs the right kind of practice to wake those systems back up. And here is the surprising part. The kind of training that helps most does not require a gym. It does not require fancy equipment. It does not require an hour-long workout. In fact, some of the most effective balance work can be done in less than 2 minutes at a time, right in your own home. That means if fear of falling has made you more cautious when you get out of bed, more hesitant when you walk into the bathroom at night, more nervous when you step off a curb, or more dependent on holding onto furniture just to move around safely, this video could genuinely change the way you move through your day. Because today, we are going to cover 6 of the most effective balance exercises for preventing falls in older adults, why they work better than the exercises most people waste time doing, and exactly how to perform each one safely at home, starting today. And I want you to stay with me all the way to the end, because after the 6 exercises, I am going to show you the simplest way to fit them into your day so you actually do them consistently. That is where the real results come from. Before we dive in, if you have not subscribed yet, go ahead and hit that subscribe button and turn on the bell notification. This channel is here to help you stay strong, steady, independent, and confident as you get older. And if this video helps you, type the number 1 in the comments below. If you think I should improve something or cover this topic differently, type 0. I read those comments, and they really do shape what I create next. Now let me start with one of the biggest mistakes almost everyone makes when they decide they want better balance. They stand on one leg. That is usually the first thing people try. They stand near a wall, lift one foot up, wobble for a few seconds, maybe hold it for 10 or 15 seconds, grab the counter, then say, "Okay, I worked on my balance today." And yes, that can challenge balance a little. But here is the problem. Most real-life falls do not happen when you are standing perfectly still in one place like a flamingo. Falls happen while you are moving. They happen when you are turning around too quickly. They happen when you shift your weight to reach for something. They happen when your toe catches the corner of a rug. They happen when you step onto a surface that is lower, higher, or slicker than you expected. They happen when your body gets pulled just slightly out of position and cannot correct itself fast enough. That means true fall prevention is not just about balance in the general sense. It is about reaction. It is about coordination. It is about whether your body can recognize, in an instant, that you are drifting off center and recruit the right muscles fast enough to bring you back before you go down. That is the real goal. And that is why the exercises I am going to show you today are different. They are not just designed to make you feel like you are doing something. They are designed to restore the exact systems your body uses to catch itself when you lose balance in real life. Before we begin, I need to be very clear about safety. If any of these exercises cause pain in your feet, ankles, knees, hips, back, or anywhere else, stop immediately. Work only within the range that feels safe and comfortable for your body. If you have had a recent fall, if you have severe osteoporosis, Parkinson's disease, a diagnosed neurological condition, significant dizziness, or any medical issue that affects your stability, please talk with your doctor or physical therapist before trying new exercises. And never do these movements in socks on a smooth floor. That is one of the easiest ways to slip at home. Barefoot is often best for balance practice because it gives your brain better feedback from the ground. If barefoot does not feel right for you, wear supportive shoes with a non-slip sole. Also, always keep a sturdy chair, wall, kitchen counter, or solid surface within reach. Not because I expect you to fall, but because having support nearby allows you to train with more confidence and less fear, and that actually helps you move better. Now let me explain the most important concept in this entire video, because once you understand this, balance starts to make a lot more sense. One of the most overlooked parts of fall prevention is not in your hips. It is not in your core. It is not even in your knees. It is in your feet, and especially in your toes. When you begin to lean too far forward, sideways, or slightly off-center, the small muscles in your feet are supposed to respond automatically. Your toes are meant to press into the ground. Your foot muscles are meant to grip and stabilize. Your ankle is meant to make tiny, fast corrections. All of that happens in a fraction of a second. That is part of your natural balance recovery system. It is one of the first lines of defense between a stumble and a serious fall. But over the years, that system often gets quieter. And it is not hard to see why. Most people spend decades in thick, cushioned shoes. They walk on flat indoor surfaces. They stop challenging their feet and ankles in meaningful ways. The tiny stabilizing muscles become weaker. The nerves become less responsive. The communication between brain, foot, and ankle becomes slower and less precise. The reflex is not gone forever, but it does get rusty. Think of it like a smoke detector with a weak battery. The system is still there, but it is not responding the way it should when you need it most. The good news is that the body can relearn. These small foot and ankle muscles respond surprisingly well to consistent practice. Your nervous system can become sharper, your reactions can become faster, your balance can improve, even if you have felt unsteady for a long time. That is what these exercises are meant to do. They are not random. They are not just senior exercises. They are targeted drills that rebuild the connection between your brain and the parts of your body that protect you when you start to fall. So let's get into the first one. Exercise 1. The toe lean. If you only do one exercise from this entire video, make it this one. The toe lean directly trains the reflex that helps stop a forward fall before it happens. Start by standing in what I call a safety corner. That means facing the corner of a room where two walls meet. Stand close enough that if you were to tip forward, you could catch yourself with your hands against the walls. If you want extra support, place a sturdy chair in front of you within easy reach. Stand with your feet close together, but not touching. Keep your posture tall, chest open, chin level, shoulders relaxed. Now slowly lean your entire body forward from the ankles, not from the hips, not by bending at the waist. Your body should stay fairly straight like a board gently tipping forward. As you do this, you will feel pressure shift toward the front of your feet. If you are barefoot, you may notice your toes naturally starting to grip the floor. That is exactly what we want. Lean only until you feel those toes engage, then use them to pull yourself back to center before you need to step. That is 1 repetition. Do 10 repetitions. And here is the key: do not rush it. The goal is not to throw yourself forward. The goal is to teach the feet and toes to wake up and respond. If this feels easy after a few days, hold a very light weight against your chest, even just 2 or 3 pounds. That extra load makes your toes and foot muscles work harder, which speeds up the training effect. You can do this exercise 3 or 4 short times throughout the day. It takes almost no time, but it sends a strong signal to the exact muscles that help stop a forward fall. Exercise 2. Side-to-side weight shifts. Not every fall happens forward. Many falls happen sideways, especially when people turn, step around furniture, reach for something, or shift their weight onto one leg without realizing how unstable they have become. That is why this next exercise matters so much. Stand behind a sturdy chair and rest both hands lightly on the backrest. Your feet should be about hip-width apart. Stand tall. Now slowly shift your weight onto your right foot. As your weight moves over, let your left foot get light enough that you can lift it just slightly off the ground. Even half an inch is enough. Hold there for about 3 seconds. Then slowly come back to center. Now shift your weight to the left side and lift the right foot slightly. Hold again for 3 seconds. That is 1 full repetition. Do 10 repetitions on each side. What makes this powerful is not the size of the movement, it is the control. You are teaching your hips, core, and feet to work together so your body learns how to accept weight on one side without panicking, wobbling, or overcorrecting. Move slowly enough that you feel the shift. As you improve, try using just your fingertips on the chair instead of a full grip. Later, if it feels safe, try it with no support at all. That is when you know your body is starting to trust itself again. Exercise 3, heel-to-toe walk. This one is excellent for what we call dynamic balance, which simply means balance while moving. Because again, most falls happen during movement, not during stillness. Find a hallway or an open space next to a wall. If you need support, place one hand lightly on the wall to begin. Now place one foot directly in front of the other so that the heel of your front foot touches, or almost touches, the toes of your back foot. Then step forward the same way with the other foot. Heel to toe, as if you are walking on a straight line. Take 10 slow steps forward. Then carefully turn around and take 10 slow steps back. That is one set. Do 2 sets. Now here is an important detail. Try to keep your eyes looking forward, not down at your feet. That can feel uncomfortable at first, but it matters, because in everyday life, you cannot always stare at the ground. You need your balance system to work while your eyes are focused on where you are going. This exercise sharpens foot placement, coordination, and the ability to control your center of gravity while walking through a narrow path. If it feels difficult, that is normal. Difficulty is not failure here. Difficulty means you are challenging the exact system that needs training. Exercise 4, standing marches. A huge number of trips happen because the foot does not clear the ground well enough. The edge of a rug, a crack in the sidewalk, a low step, a threshold between rooms. When the foot lifts too slowly or not high enough, a small obstacle can become a big problem. Standing marches help fix that. Stand behind your chair with your hands resting lightly on the back. Stand tall through the spine. Now slowly lift your right knee up toward your chest as high as you comfortably can without leaning backward. Pause for 2 seconds. Then lower it slowly and with control. Now repeat on the left side. That is 1 repetition. Do 10 repetitions on each side. Do not rush the movement. The lifting part matters because it improves the ability to clear obstacles. But the lowering part matters too, because that is where you build control as the foot comes back to the ground. That control helps stabilize you during walking. As you get better, try doing the marches with just fingertips on the chair. Then, eventually, try them without holding the chair at all, with your arms out slightly to the sides if needed for balance. This exercise also helps restore confidence, because once people start lifting their feet more clearly during walking, they often feel less afraid of catching a toe on everything around them. Exercise 5, clock reaches. This is one of my favorite exercises because it trains balance in multiple directions at once. Real life does not happen in a straight line. You reach forward, you step sideways, you turn backward, you twist to grab something, you lean, you recover. That is why balance training has to include changes in direction. Stand behind a sturdy chair. Hold the chair lightly with your right hand. Now imagine you are standing in the center of a large clock face drawn on the floor. Your left leg is going to reach toward different numbers on that clock. First, slowly tap your left toes forward toward 12 o'clock. Return to center. Then reach out to the side toward 9 o'clock. Return to center. Then reach back and slightly behind you toward 7 o'clock. Return to center. That is 1 round. Do 3 rounds with the left leg. Then switch sides, hold the chair with your left hand, and reach with your right leg toward 12 o'clock, 3 o'clock, and 5 o'clock. Keep a soft bend in the standing knee, and stay tall through the chest. This movement builds ankle control, hip strength, and single leg stability all at the same time. It also trains the body to stay steady while one leg moves in different directions, which is exactly what happens during walking, turning, and reaching in everyday life. Exercise 6, sit to stand without using your hands. This one may seem simple, but it is one of the most practical and important exercises in the entire routine. Getting up from a chair is one of the highest risk moments for a fall in older adults. And the strange thing is, most people never practice it. They do it many times a day, but they do not train it intentionally. Sit near the front edge of a sturdy chair. Place your feet flat on the ground about hip width apart. Cross your arms over your chest if you can. Now lean slightly forward from the hips so your nose moves over your toes. Then press through your heels and stand up slowly, with control. Once you are fully upright, pause for 2 seconds. Then slowly lower yourself back down to sitting. Do not drop into the chair. Control the descent the whole way down. That is 1 repetition. Start with 8 repetitions. If doing it without your hands is too hard at first, that is completely okay. Place your hands lightly on your thighs for assistance and use just enough pressure to help. Over time, rely on your hands less and less. This exercise improves leg strength, coordination, posture, and balance all at once. And because standing up safely is something you do every day, the benefits transfer directly into real life. Now here is something important. You do not need to do all 6 exercises in one long workout. In fact, for most people, that is not the best approach. What works better is something I call balanced snacks. Small bursts of practice spread throughout the day. 30 seconds here, 1 minute there. A few repetitions while the coffee is brewing. A set while you are waiting for lunch to heat up. A round while the commercials are on. That style of practice fits real life better, feels less overwhelming, and often leads to much better consistency. And consistency is everything. Because balance is not built by one heroic workout. It is built by repeated signals to the nervous system. Every short practice session reminds your brain, feet, ankles, and legs how to communicate more effectively. Over time, those signals add up. The corrections become quicker, the movements become smoother, the body becomes more confident. That is how real improvement happens. So if you are wondering how to start without getting overwhelmed, here is the simplest plan. For the first week, focus only on the toe lean and the side-to-side weight shifts. That is enough. Do them daily. Get comfortable. Learn the movements. Let your body begin waking up those foot and ankle reflexes. In week 2, add the heel-to-toe walk. In week 3, add standing marches. In week 4, add clock reaches. In week 5, add sit-to-stands. By then, you will have a complete balance routine that still takes less than 10 minutes total if you spread it through the day. That is the beauty of this approach. It is simple enough to stick with. And the people who improve the most are not the people who do the most on day 1. They are the people who do a little, consistently, until it becomes second nature. Now I want to say something that matters more than most people realize. Please do not skip these exercises on the days when you feel steady. Those are the most important days. Because when you feel fine, it is easy to think you do not need them. But balance training is not just about helping you in the moment you practice. It is about building an automatic response for a future moment you do not see coming. A moment when your shoe catches. A moment when your foot lands awkwardly. A moment when you turn too fast. A moment when your body starts to go and you do not have time to think. That is what you are preparing for. You are teaching your body what to do before your mind has time to react. And that is the difference between a close call and a devastating fall. Because a bad fall is rarely just a bad fall. It can mean a fractured wrist, a broken hip, a hospital stay, a loss of confidence, weeks or months of reduced mobility, a new fear of walking alone, sometimes even a loss of independence. That is why this matters so much. This is not really about exercise. It is about freedom. It is about getting out of a chair without hesitation, walking to the mailbox without anxiety, turning around in the kitchen without grabbing the counter in panic, stepping outside your front door and feeling like your body is still on your side. That is what we are protecting here. Your confidence, your routine, your independence, your life on your own terms. Now, before we wrap up, I need to tell you something equally important. Balance is only half of the fall prevention equation. The other half is leg strength. And this is where a lot of people make a major mistake. They focus only on wobbling exercises and ignore the fact that even perfect balance cannot fully protect you if your legs do not have the strength to react. Think about what your legs have to do every day. They have to catch you when you trip. They have to push you back upright when you start to tip. They have to support you when you climb a step, get off the toilet, stand up from the couch, carry groceries, or walk across a parking lot. If your legs are weak, your reaction time gets slower. Your push-off power gets weaker. Your knees and hips become less stable. And when that happens, even small stumbles become much harder to recover from. Research has shown again and again that older adults with weak legs are dramatically more likely to fall than those with stronger lower body muscles. And unfortunately, leg strength is one of the things we lose fastest as we age, especially if we sit more, move less, and stop asking those muscles to work. But I want you to hear this clearly. Your legs can get stronger at any age. I do not care if you are 70, 78, 85, or beyond. Muscle still responds. Nerves still respond. Strength still responds. The body is more adaptable than most people think. No, you do not need to become an athlete. No, you do not need to join a gym. And no, you do not need complicated equipment. What you do need is simple, safe, consistent practice that tells your body, we are not giving this up. That is why, if you found this video helpful, the next thing I want you to do is work on leg strength too. Because when you combine stronger legs with better balance reflexes, that is when you give yourself the best possible protection against falls. So here is your action plan. Start today. Not next Monday. Not next month. Today. Pick 2 exercises, the toe lean and side-to-side weight shifts. Do them safely. Do them slowly. Do them consistently. Then build from there. If you are serious about staying independent, do not wait for a fall to convince you that balance matters. Train it now, while you can still improve it on your terms. And if this video helped you, type 1 in the comments, so I know to make more like this. If you want me to improve something, type 0. Your feedback genuinely helps. Please like this video, share it with someone you care about, and subscribe if you want more practical health guidance designed to help you stay strong, mobile, and confident as you age. Thank you for watching. And here is to steady steps, stronger legs, and living life